Cancer is a general name for a group of more than 100 diseases. More than 1 million people in the United States get cancer each year. Over the last several decades, we have seen advances in cancer treatments. One type of cancer is called multiple melanoma, a cancer of cells in the bone marrow. It is important because once a rare disease of the elderly, multiple melanoma is growing in numbers and increasing among young people. It is also important because new updates to treatment are now bringing hope to people living with the disease. Here to talk about the latest tools in the cancer-fighting arsenal are Dr. Ken Anderson, Terry Barter, who is living with multiple melanoma, and his wife, Diane. Dr. Anderson, what exactly is multiple melanoma, and who is typically diagnosed with the disease?
Multiple myeloma is a bone marrow cancer. In the bone marrow, there are too many abnormal plasma cells which make antibodies. But more importantly, there are not enough normal cells making red blood cells, so patients can be tired from anemia, too few white blood cells, so at risk for infection, or too few platelets and at risk for bleeding. The most sinister manifestations of myeloma are kidney disease and bone disease with fractures and pain. Traditionally, myeloma has been a disease of the elderly, but the average age is 60, so that there clearly are more and more young people recognized who have this disease as well. And only a decade ago, really, we had very ineffective treatments for this disease, but today there's been a revolution in treatments, and many, many patients now are doing well, living 2 and 3 times longer, having a chronic illness and a quite quality long-term life with their families.
Thank you. Terry, when were you diagnosed with melanoma, and how have you been able to control the disease progression?
Well, 14 years ago, I was diagnosed with multiple myeloma, and at that time there weren't many treatments available. They said if I did nothing, I probably had 2 years, and they offered me a bone marrow transplant, said I might have 5 years, but I'd be sick and probably be out of work for a year. That didn't sound too good. And Dr. Ken Anderson, he told me about this new targeted oral drug that was coming to trial called Revlimid. I got on that trial, and today I'm just taking 1 pill a day and living a great life. I've had 8 new grandchildren born, making a total of 11. 2 sons get married. Life is good.
That's great. Thank you. Dr. Anderson, what is the newest treatment for patients, and why is it so important to have multiple tools to fight this type of cancer?
So Terry went in now a long time ago on a new medicine called Revlimid. He was the first person to ever do this on a clinical trial. This drug kills cancer cells directly and also stimulates the patient immune system, and this medicine is now helping patients worldwide with multiple myeloma. There's a new one called pomalidomide. We have other classes of medicines called proteasome inhibitors. We need, honestly, to have different classes of medicines that attack myeloma cells in different ways in order to combine them and form teams to really make a major difference. And we've had 11 new FDA-approved treatments for myeloma, and as a consequence, patients are doing even better than they ever have been, with a brighter future still.
Thank you. Diane, what has been the most valuable resource for you since your husband was diagnosed with multiple melanoma?
It was very important in the beginning of his disease of multiple myeloma to seek out support groups and find some that had patients living with multiple myeloma, and also help for the caregivers was very important for me. It helped us a lot in the beginning. We still attend support groups now, but we feel like we're there to give back a lot. When we walk into our monthly meeting, they see Terry coming and they say, "Oh, here's Terry, our inspirations," and their faces light up when they see him because he gives them hope.
That's just fantastic. Thank you. Diane, what would you say to wives or significant others who have a partner with melanoma?
I would say definitely seek out a support group with patients who are living with the disease, and go to your centers that really specialize in this kind of cancer.
Thank you. Dr. Anderson, what are some of the symptoms of melanoma?
Well, patients can get low red blood cell count and anemia. Consequently, they can be tired or fatigued. Sometimes they can get an increased risk of infection, or rarely they can have bleeding. The most common way patients present with myeloma is with pain, bone pain, commonly in the lower back.
Thank you. Doctor, could you tell us where we can go for more information to find out about melanoma?
For sure. There are centers of excellence that really should be a wonderful resource for patients. The developments are happening so rapidly that you really do need to have awareness and access at a center of excellence to cutting-edge care. And then you can go onto the web. There are excellent sites, the International Myeloma Foundation, the Multiple Myeloma Research Foundation, Leukemia Lymphoma Society, among others, are invaluable resources.
Thank you. That's all I have today. Have a great day.
Thank
you
you
very much.
Bye.